It's our ECU Health Spotlight. We do it once a month, and we focus on something going on at ECU Health. And today I'm excited because my buddy Glenn Simpson is here. And Glenn always keeps me balanced because he is the service line administrator for behavioral health at ECU Health. And you have that personality that's just so calming.
Oh,
and
thank you. Yes,
keeps
you
us
kind
all
of need to
very
be
calm.
when you're talking
and
about
I need to be
mental
calm
health.
because my audio's not working.
Yeah.
How you doing?
I'm doing very well.
Good
Happy to
see
be
you.
here with you.
You have a big event today, which we'll talk about, but it's also Mental Health Awareness
It is.
Month. So tell us what's planned.
May has been Mental Health Awareness Month, Henry, since 1949, and it's to bring education and awareness to folks about mental health and well-being, and also to celebrate those people in recovery for mental illnesses and substance use disorders. So we have been promoting it for a number of years, and we're very excited to be here today to talk about May's Mental Health Awareness Month.
So why is it so important that we all talk about mental health?
Well, mental health is health. And so just like it's important to talk to our friends, family, etc., when we are having some physical health concerns, aches and pains, whatever it may be, it's even as important, if not more important, to talk about our mental health concerns. And many of us struggle with being able to bring up the topic, either with others that we love, that we think may be struggling, or within ourselves. So for folks that are struggling, really, to be able to speak to somebody and just let them know what's going on.
So we hear the term mental health and we hear the term mental illness, but there is a difference, right?
There is. So mental health is health, and like physical health is on a continuum, so is mental health. So say if somebody's a little anxious before a test or a presentation or talking to Henry Hinton, that's pretty normal.
Yeah.
Say if somebody's saddened after a loss or some tragedy or something they've heard, that's normal. But when it becomes unusual is when it's growing into a illness, and that those illnesses can be treated effectively if we catch them early enough.
Growing up, we didn't talk about mental health.
No.
When in my teen years, my growing up years, we didn't hear much about it now, but now people talk about it a lot, and it's become we've come a long way in understanding how important it is and what needs to be done to keep people healthy mentally, right?
Right.
Yeah. So why is that? What has the research just advanced that much?
Well, first of all, the medicine has advanced that much, and the treatment options have advanced that much. But really interestingly, over the last few years, due to the pandemic, we all experienced a collective anxiety, right?
Yeah.
At some level. And so what happened through the pandemic is people started talking about their worries and fears a little bit more than what they had before. And that kind of opened up the door for folks to have a broader discussion about mental health and well-being. Also, over the last several years, we've seen some public figures bravely share about their own substance use or mental health struggles. And mental illness can impact anyone. It's not related to socioeconomics or race or gender, just like heart disease, cancer, etc.
So give us some warning signs if people are getting into the danger zone. When do you seek help? What kind of things are happening that may lead people to stop and realize, hey, I need to seek some help here?
Right. So a lot of times it's really a change in behavior, something different than what we've been experiencing before. Some of the mental health symptoms actually look like physical health problems, say unexplained stomach aches or back pain or headaches, etc. But really, if somebody feels sad or down for greater than 2 weeks, especially if there's not a reason really for that, changes in behavior, like maybe somebody who gets a good night's sleep and now can't sleep at all, or is now sleeping excessively, constantly fatigued and tired. Increase in alcohol use and using drugs, that can often be a sign. And some people have actually suicidal thinking, thoughts about wanting to hurt themselves. And that is probably more common than what a lot of people would think.
So what if you notice this in one of your spouse, or teenage suicide is a big deal.
Yes.
We've, especially through the pandemic, we've seen that, an increase in that. What are the warning signs for a loved one, and what kind of action do you take if you see someone else you think is struggling?
Sure. So some of the warning signs I mentioned, and really kind of think of mental health or mental illness impacts emotions, behaviors, and thoughts. And sometimes it's all three of those. So again, changes in behavior, somebody's not acting like they were acting a month ago, retracting from family and friends, giving up some hobbies, just those type of changes that we see in not a positive way. And really just reaching out, because a lot of times people aren't going to say, hey, I'm feeling really depressed.
Right.
But if we really generally say, how are you doing? Or you seem a little different than the last time we met. That may open it up. And you'd be surprised how many people, if they have the opportunity, are willing to share with a trusted loved one, friend, pastor, and also our physicians, right? So when we go to the doctor's office looking at physical health, well, they also look at mental health. And in many cases, we take a little questionnaire when we go in to kind of help them determine, do we have something going on? But if somebody's not so sure who to call or want to remain a little bit anonymous about it, there's a national mental health helpline, 988. 988. You can call or text 988 24 hours a day, 7 days a week, and you will be connected to an in-person trained behavioral health worker that's going to listen to what the issues are and be able to provide resources as appropriate. And here in North Carolina, all the 988 calls are answered right here in Pitt County at a local agency.
For the whole state?
For the whole state.
Wow.
So we're pretty proud about having them.
Yeah,
with us.
no kidding. I remember you talking about this last time, 988.
988.
It's kind of a new thing, right?
Yeah. This summer, it will be 3 years since it came out. And before that, there was similar lines, but they were like 10 digits. And who can always remember 10 digits? 988. So think of it as the mental health helpline and emergency line for mental health, kind of like 911.
Right. 988. 988. All right. What's ECU Health doing for Mental Health Awareness Month?
Well, we're very excited. We've been involved in community presentations, lots of social media posts, traditional media, like here today. We've also started erecting the steel structures for a brand new behavioral health hospital.
Going to ask you about that.
That's scheduled to open the summer of 2025. It will be a state-of-the-art facility, and we will be able to perform treatments and serve populations that we're not able to serve today. So very excited about that. And then today, just a few hours from now, from 10 to 2, we have our 12th annual Mental Health Expo. And that will be held at the Eastern Area Health Education Center, which the physical address is 2600 West Arlington Boulevard. But if you go up Arlington North to the end, it crosses over 5th Street. It's the building on the right-hand side, almost directly behind ECU Health Medical Center. And there, Henry, we will have over 50 agencies to talk to folks about the resources available right here in our community. This is a local, regional event. And we will also have 3 presentations, one on emotional well-being, just like we were talking about, also one on trauma, and then one on addiction as well. And those presentations are between 10:30, 11:30, and 12:30, completely free. And we encourage folks to stop by and learn more about mental health anytime between 10 and 2 today.
10 and 2 today. Good stuff. And it's open to the public.
Open to the public.
Mental Health Expo at the Eastern AHEC building, 2600 West Arlington, from 10 to 2 today. Sounds great. What did we miss that we need to talk about? Anything else that on your mind about mental health awareness and the special month?
Well, I think it's important for folks to know that help is out there.
Yeah.
And mental illness and substance use disorders are often recoverable. They're certainly treatable. And it's just seeking the help that we need. Kind of in the behavioral health field, we have a little saying is acknowledging there's a problem is halfway to resolving it. So sometimes we're hesitant to share what's going on the inside, right, because of shame or whatever the case may be. But if we can let somebody know, the earlier the better. And we know that if we catch a mental illness in the early stages and treat it, there's a great chance that it will resolve without getting worse.
They don't call it therapy for nothing, right?
They don't call it therapy for nothing.
Keeping it inside and not talking about it to someone is part of the problem.
Mm-hmm.
Yeah.
Yeah.
So, yeah. All right. Well, it's great to see you.
Yeah, you too.
Thank you for coming
Thank
in. Always great to see you. Glenn Simpson from ECU Behavioral Health. And again, we are excited about the fact we got a new mental health hospital that'll be opening here almost a year from now, right?
Just a little bit over the year from now.
I hadn't driven by it recently. They've got the steel up.
The steel is up.
And for folks who don't know where it is, it's on McGregor Downs Road.
Right near the nursing home.
Right, yeah, near the nursing home and kind of off Arlington behind the nursing school.
Correct.
Yeah, kind of
at the end of Allen Road.
Right. All right, good to see you, Glenn.
Yeah,
Thank you.
thank you, sir.
All right, appreciate it. Great information.